African countries. And this president is also a global champion appointed by WHO, World Health Organization, and also a regional champion appointed by SADC. The missing component was the continent. Today, President Hichilema from Zambia will become our champion for cholera. And the third one, we are talking about people, we are talking about communities. Everything starts at community level. We want to have our community to be informed. We have to create, to raise awareness. Where we can find this champion? Let us go to a country that is the largest one in terms of population in Africa. This is Nigeria. And we are so glad that President Bola Tinubu from Nigeria accepted and will be approved today by the AU Assembly as the champion for the Community Health Delivery Partnership to push the agenda of 2 million community workers by 2030. What is the last area? The last area we are talking today is about fighting some diseases. Ladies and gentlemen, let me tell you, my commitment with my colleagues from Africa CDC is to see the end of HIV by 2030. We need to accelerate this agenda because HIV is not over. HIV is still there, and statistics are showing us that every day young people are affected. We are talking about the manpower of Africa. This is why today AU Assembly will send a strong message for the reauthorization of the PEPFAR. This is the presidential initiative in the US to fight HIV. That is giving Africa every year $16 billion. And let me remind you, PEPFAR is contributing around 30% of the Global Fund envelope. In addition to these three areas, we had a wonderful opportunity to discuss a number of challenges that Africa is facing. What is the best opportunity for us if it's not to meet ministers of health? Yesterday, we discussed these challenges with about 30 ministers of health coming from our countries and giving them opportunity to discuss their legacy, giving them opportunity to network. I saw a minister from Capo Verde sharing experience to ministers of Benin, how they eliminated malaria. That is the first killer of our children in Africa. This is what I wanted to share with you, members of press. It's an exciting week, and we hope in Africa CDC, after this week, we'll say Africa is not running, it's flying with the agenda of public health security. I thank you.
Thank you very, very much, Dr. Kaseya, the Director General of the Africa CDC, ending there with a very positive note on Africa actually flying with the public health work on the African continent. So now it's time for our question and answer section. As usual, please indicate by just raising your hand. And if you've been asked to speak, please give us your name and then go with your question. Can we have a show of hands? I see one at the back, one in the front. All right, let's start with you two. Just wait for the microphone.
Thank you. My name is Asagid. I'm from Addis Media Network, and I have one question. How many countries started administrating malaria vaccines so far, and what are the practices to administrate for new continents?
Okay. Can you just hand it over to...
Thank you. This is Marsha Kali from Manharia Radio. You haven't said anything about Ebola, but it's happening as a pandemic here and there, especially in Western African countries and other countries. So you haven't said anything about that. I was wondering that you may say something about that, if there is any information.
Okay, DG, we may proceed with those two.
Thank you very much. Africa CDC is working tirelessly to ensure that all African people can get vaccines they want to save their life. As I said, malaria is the first killer of our children. And we are supporting all clinical trials research on the malaria vaccine. We are glad that today, as you saw, we have Cameroon, that is the first country introducing malaria vaccine. And let me inform you that next month I will be in Cameroon with other colleagues to celebrate that and to see how other countries can learn from Cameroon. We are working to ensure that there is availability of vaccines for all African countries. But more important, we are also working to start to manufacture this vaccine in Africa. This is an agenda that we believe that we can achieve in a few years. About Ebola. Ebola is still a major public health issue in Africa. We have a number of countries affected, mostly from Central and Eastern Africa. And we also know, thanks to the support that Africa CDC provided, there is an African vaccine against Ebola that was finalized in DRC. And I want to commend the team from Professor Muyembe and what we call Institut National de Recherche Biomédicale. If you can remember, it was a shock for all of us when in 2016, West Africa was affected, and when an American medical doctor got Ebola, he was airlifted in the US and he was treated. It was that time that the world saw that there was a medicine that can cure Ebola. Today, this medicine is also available for all of us. Thank you.
Thank you very much, DG. I want to raise one question that perhaps our colleagues may not have been aware of, that in the past few weeks, the Africa CDC was celebrating 7 years of its existence. And clearly there are achievements, major achievements that were made, and also perhaps some of the issues that might have been challenging during that time. So could you just briefly update us on what it is that you were celebrating on that 7th year anniversary?
Thank you, Win, for this question. In my small experience of 28 years in public health, I didn't see an organization making huge impact in 7 years like Africa CDC. Africa CDC is still young, but Africa CDC today is celebrated as a world-class public health organization, leading the agenda of health in Africa, contributing for the public health security in the world. What we're celebrating, it's a range of what Africa CDC did to support African countries. Let me give you some figures. We had only 2 countries with capacity to conduct what we call the genomic sequencing. Today, with Africa CDC support, we have 40 countries. And we are moving. Let me tell you, we didn't have emergency operation center, public health emergency operation center in Africa. Today, we have 17 countries, and we have 21 in 2024 that will join the cohort. And this agenda of local manufacturing, we are not talking about it. Today, we have a clear idea who is doing what where, and we are celebrating successes. You saw me flying to Kenya to visit the only African company manufacturing syringes. And a number of successes we are celebrating for the 7th anniversary become the foundation for us for the next 7 years. Because we want, after 15 years, to say, how did we do to double our effort and to double the impact for our African people?
Thank you very much. That was, all right, I see there's a question there. Please go ahead.
My name is Hilary Orinde with the International News Agency AFP. You mentioned over 350,000 cases of cholera. Are we seeing a trend where it's going down? And is Africa CDC with enough stock to, say, vaccinate people across the continent? Do you have any worry about the cholera outbreak that you're witnessing, especially in the south of the continent?
Thank you. I will respond to your question by first bringing something that is critical, the climate change. The cholera outbreak we are facing in Africa, mostly in Southern Africa, is the result of climate change, started by cyclone. If you see the period of cyclone in Africa is mostly end of January, February, and March. It means we are still there. And we have a country, DRC, out of 26 provinces that they have, 16 are flooded today. This climate change impact to the health sector, in addition to lack of water and sanitation and hygiene in a number of our countries, especially in new settlement, in addition to poor surveillance mechanism. All of them are facilitating this outbreak, the cholera outbreak. Now, what Africa CDC is doing, yes, currently the trend of the cholera outbreak in Southern Africa is decreasing. But with what I told you, we are in alert mode, because we know that with the cyclone, the rainy season, we can have more cases and more deaths. Africa CDC is supporting to build strong surveillance system in our countries, to build community awareness, and we have a strong component on risk communication for our communities. We are supporting to provide commodities to countries, but we are also supporting, ladies and gentlemen, to have a cholera vaccine manufactured in Africa. We are close to that. How close? We have a vaccine, what we call the clinical trial phase 1, already completed. Africa CDC is talking with all partners to get $15 million to complete the phase 2 and the phase 3. And if we get this $15 million, this vaccine can be available in the next 2 days. It's long, but in terms of vaccine manufacturing, it's not long. And we are working tirelessly to ensure that this vaccine will be available in that period of time.
Okay, we have now 3 hands going up. So let's go in the order. 1, 2, 3, please. Very quickly, we are running out of time, so please make your questions very short.
Okay, thank you. My name is Sergey from what is the willingness of countries to cooperate in this area?
All right, the second one.
Okay, thank you very much. My name is Belet Tarak. I am from Amara Media Corporation. My question, healthy citizen is mandatory for achieving development goals. However, many Africans are close to be exposed for both communicable and non-communicable diseases like HIV and others, cholera as my friends raised. What are the measures being undertaken by CDC Africa and member states of Africa for controlling this issue?
Thank you very much. My name is Osman Mohammed from Amara Media Corporation. Your Excellency, what's the strategy has been done effectively to reduce HIV and AIDS and other majority challenges in Africa? 75% of African countries, they are young, and this is big challenge. Let's become one of the challenges. Thank you very much.
Thank you. Those are your last three questions, DG.
Thank you very much for these questions. Let me start with these cross-border activities. I want to be clear on that. No one will be protected if others are not protected. No country can say I'm safe with other countries in the region and the continent are not safe. We learned from that. And this is one of the key lessons that is driving us when we develop the new public health order. It means the regional approach. We are glad that our countries, not only they accept the leadership of Africa CDC, but they are collaborating. As I told you, yesterday we had over 30 ministers in Addis discussing these cross-border activities. We have what we call the Joint Emergency Action Plan that we developed with WHO and Africa CDC to support these cross-border activities to make all African countries safe. And now what we are doing is to support joint applications to pandemic fund to ensure that all regions will be protected. In terms of non-communicable diseases, this is not another outbreak that we have in Africa. A silent one. Talking about diabetes, talking about high blood pressure, talking about all of them. Cancer and others. We developed a strategic plan to combat the non-communicable diseases. And we have a range of activities we are supporting. First, our people can have good behaviors. Our people can understand this issue and avoid that in terms of practicing sport, eating healthy, a number of areas, stop smoking and others. But we have also to ensure that our countries, they have appropriate policies and standards. And they are also providing funding for that because we need domestic resources complemented by external resources to combat these NCDs. And Africa CDC is supporting for this dialogue. We have another one that we are not talking too much about. This is what we call antimicrobial resistance. This antimicrobial resistance is killing more than HIV, TB, flu combined. I say combined. And Africa CDC decided to develop a strong program to fight antimicrobial resistance. We can have another opportunity one day to talk more about that. About HIV, as I said, we have more young people affected. If you see the trend, more than 70% of cases are in Africa. And losing our young people, it means killing our economy. It means stopping our development. Strategies are known. At political level, what we are doing as Africa CDC, as I told you, we are supporting the reauthorization of PEPFAR to ensure that our countries have sufficient funding. We are also talking with our countries, and let me share with you, this year we'll organize an extraordinary summit on HIV and health financing to ensure that our countries are still committed to fight HIV. And then we have other strategies at personal and community levels, as you know, because this is a behavior change issue. We are committed to finalize this agenda by 2030, as we said, and we'll do our best for that.
Thank you very much. That was the Director General of the Africa Centers for Disease Control and Prevention, Dr. Jean Kaseya, talking to us on the status of public health events on the continent and the Africa CDC's interventions, and also on Africa CDC's impact on public health and the 2023 annual report, some of the major initiatives such as local manufacturing, saving lives and saving livelihoods. And I think he has really expanded beyond that to give us much, much more information. So at this point, let me thank you all very much, those who are in the room and those who joined us online. Thank you for attending this briefing. We will have another briefing coming up in this very same room at 11:15, featuring the chairperson's special envoy on youth issues. For now, bye-bye, and thank you.